If you talk about different types of treatments, of course, we've already talked about the earliest forms of intervention, which are the medications and the weight control that I mentioned. We try different types of prescription medications, physical therapy, and injections. Physical therapy is kind of a controversial one. You know, it's helpful to have strong muscles that surround the knee joint. When your muscles are weak, then the contact forces between the bones of the knee becomes greater and can increase the pain. But when you've got arthritis that's so bad that you've basically lost the cartilage and you're rubbing bone against bone, there's not a whole lot generally that physical therapy is going to do for you. But that's something that we try in cases other than end-stage cases of arthritis. But when none of these things work, we turn to different types of surgery, particularly knee replacement, as a solution for a number of people. If you look at the number of knee replacements performed annually in the United States, you can look at this graph that shows a pretty constant rise in the incidence of knee replacements over the last 12 or 13, what is that, actually 15 years now. 800,000 total knee replacements approximately were performed in the US last year, and this is only going up, which is obviously a very important public health concern as we talk about things like Obamacare and Medicare reform. So if you come to the office or if you see a doctor for knee arthritis, you might be asked one or more of these questions to determine how significant a problem this is for you. Does your knee hurt one or more days per week? Does the pain interfere with your sleep? Is it painful for you to walk more than a block? Are your pain medications no longer working? Is knee pain limiting your participation in activities? Has inactivity from knee pain caused you to gain weight? That's a common one. People come in all the time and say, you know, all you doctors keep telling me to lose weight. How can I lose weight if I can't even walk? Can you limit activities for a few months to recover from surgery? That's a very important question because surgery isn't an overnight fix. It's a process that takes not only the day of surgery but several months afterwards to recover from. And are you willing to commit to working hard during the rehab for a successful recovery? So those are all important questions to ask yourself. So let's look at a few knee replacement facts. Knee replacement surgery is a successful operation. If it weren't, we wouldn't be doing 800,000 of these annually in the United States. But in general, about 85% of people that go through knee replacement surgery would say that they're satisfied, and if they had the opportunity to do that, operation over, they would do it again. So that's pretty good, but you know, what you should also know that although knee replacement can be done safely and effectively, there are numerous potential drawbacks of knee surgery. The performance of a joint replacement depends on a lot of factors, including your age and your weight and your activity level. There are potential risks, including infection and other things, and that recovery does take a period of time. People with infections or other conditions limiting rehab, severe obesity, bad lungs, bad heart that wouldn't allow them to exercise afterwards might not be able to successfully rehabilitate after the surgery. And there are several potential complications which could occur afterwards, which could result in stiffness or unsatisfaction with your new knee, including loosening of the implant where it attaches to the bone, or fracturing of the bone that surrounds the implant, or the components can wear out. I think, you know, the last thing, this wearing out of the components used to be a problem 10, 15, 20 years ago, but as materials have improved and the science of metals and plastics that are used to improve these knee implant designs has improved, the wearing out of the components is much less of a concern. We don't see that really to any large extent today as we did 10, 15 years ago. So in my opinion, 85% is good. I mean, that's at least a B or B+, but what about the other 15% of people? And so this is what modern science, modern orthopedic surgery is dedicated towards doing, is improving the outcomes of knee replacements so that we can get a greater satisfaction rate and we can improve on the people that haven't been so satisfied with their knee replacement. So let's talk a little bit about what those improvements might be that might improve the outcomes of knee replacement. I think you can broadly think about this in two categories. There's the type of knee replacement, just like there's different kinds of cell phones or televisions or watches or what have you. There are a number of different types of knee replacement. And then there's the technique of knee replacement. Assuming that you choose the right knee replacement or you choose the right doctor to put it in for you, you have to rely on that doctor to put it in correctly. There are numerous important steps that are essential for getting the knee to work properly. And so we'll spend a few minutes over the next 5 or 10 minutes talking about not only the types of knee replacements that I think are exciting, but the techniques of putting these in that's really improved the outcomes.